Good morning, everybody. I haven't been on here for a very long time, and I really wanted to give you an update on how I've been doing with my health because I receive a lot of different messages and comments on my YouTube videos asking for an update. So I wanted to provide that because other testimonials, other vlogs have really helped me on my own journey. The last few months have been the most difficult few months of my entire life, health-wise, mentally, emotionally, physically, and I'm in a little bit of a better place, and I feel that I'm able to make this video. So to catch you all up, there's a lot that happened. I received my first set of PRP injections from C0 down into my thoracic spine in January, and then I made a video on how I was doing after that. I was doing pretty well about 6 weeks after the PRP injections, but I did have new symptoms of leg weakness and collapsing legs. I have really difficult symptoms with my bobblehead, choking sensation 24/7, and my weakened collapsing legs when my atlas is out. So it's worse when my atlas is out, my C1 bone. So that was our focus for a while, was trying to get to see my atlas orthogonal chiropractor to ensure that I was in alignment, but we were so far from my doctor that it was hard to get there consistently. So I had my second PRP injections in April. And that was again from C0 down into my thoracic spine. I also have an unstable pelvis, and so we injected my SI joints, my sacroiliac joints, to try to stabilize my lower pelvic area. And there was a lot that happened. So before that second set of PRP injections, I had to have an emergency abdominal surgery for something unrelated to my neck. So this was about 3 weeks before my second PRP procedure, and typically when someone has a medical condition, they don't have CCI, so they're not worrying about their neck. I was in so much pain, but also had the bobblehead, the choking, so much going on with my neck, and I had to constantly advocate for myself in the hospital to make sure that my neck was being taken care of, because our necks are very vulnerable. So I just wanted to provide some steps that I took when I was being intubated for my surgery with CCI, in the case that you have a similar situation and you don't know what to do, and these might serve as a few recommendations that you want to consider. The first thing I did was I connected with my CCI doctors. So my doctors were really great. They collaborated with me. They suggested that I wear my soft collar for the surgery, and this would do two things. It would protect my neck while allowing a little bit of flexibility for the intubation. I don't typically wear a rigid hard collar unless I'm traveling, so a soft collar made sense for me. And the second thing that wearing a soft collar can do is it serves a reminder to the other staff who are going to be moving you from one bed to another while you're asleep, or even transporting you from the surgical unit to the ward. And this was really important for me. I just wanted everyone to know that I had something wrong with my neck, so that everyone would be careful, because my neck is very vulnerable. And so I wore my soft collar. The second thing I did was I spoke with the anesthesiologist about my situation. I wanted the anesthesiologist to know that I do have CCI and that my neck is extremely delicate, because when you intubate someone for surgery, you have to put the neck into extension to put the tube down into the intubation area so they can secure an airway. And it was very important for me to ensure that the anesthesiologist heard from me my diagnosis, not from a nurse or from a doctor. I wanted to make sure that that message was literally conveyed from my mouth, so that I knew for sure that they knew. and the anesthesiologist I had was really great. Typically, you see your anesthesiologist right before you go into the surgical unit. If it's not like an acute trauma, you have time to ask them questions, they ask you questions, so there is usually an opportunity to speak directly with your anesthesiologist. When I did that, I made sure they knew that I had a CCI diagnosis, that my neck was extremely fragile and vulnerable, and that full extension was not an option for me for the intubation. The other thing I let them know was that I didn't want any medical students, I didn't want any nursing students or anesthesiologist assistants doing the intubation. I wanted it to be the most experienced person, and that is the anesthesiologist themselves. And I let them do what they thought was best because they know their comfort zone, they know their comfort level with intubation, so I didn't want to tell them what to do necessarily. I just wanted to let them know this is the situation and my neck needs to be taken care of. So they were very receptive of the situation, and I wore my soft collar. I was wheeled in. I heard the surgeon and the anesthesiologist remind all the staff, so all the nurses and the other students and physicians, that I did have a vulnerable neck. So for transporting me, they had to be careful. The anesthesiologist numbed my throat with lidocaine and didn't put my head apparently into full extension. She was able to get the tube into the proper location. So when I woke up from the surgery, I definitely, still had CCI. My atlas was, of course, out of position, but I didn't have worsening of my symptoms. So I think the intubation was a success, and I am so grateful that nothing happened to my neck. Sorry, I took a quick break for my neck. It's difficult for me to sit here, but I just wanted to be outside. So, where was I? So I told you about the intubation and some things you might want to consider if you have surgery with CCI. The next thing I wanted to tell you all was that I was approved for my second set of PRP because this surgery happened about 3 weeks before my PRP was scheduled, but I was approved and I was told that I could still get the PRP because it was still enough time for me to heal. So I made sure I was on probiotics, and I was also told that the antibiotics and how they affect your gut flora shouldn't affect the PRP outcomes. So that was good news. So I got ready to get my PRP. On the way to the PRP, we had to fly, and I have never been in such bad turbulence in my entire life. Thankfully, I always wear my hard collar when I fly, and it was terrifying. The plane was going through really, really difficult winds. The plane was like tilting, things were falling, people were screaming. I was sobbing because I was so terrified of my neck being injured. Soft collar wouldn't have been okay for the turbulence. My partner also kind of pushed my my chest against the seat and held my elbows so I could brace my head with my arms so that my head and my neck were moving as a unit. So much that happened that I still can't believe my body went through that. And I got to my doctor, I had the PRP. The PRP was done well. There was no complications in terms of like the actual intervention, so that went really well. I flew back home to be with my parents so that I could recover and so that I could receive AO treatment for my neck. The next few weeks after the PRP have been so difficult as well. Sorry, I'm just gonna hold my neck. Where do I start? So I received PRP, and for me, the theme is that for a week or two, there's inflammation, so I don't necessarily feel more stable but my symptoms don't worsen. They stay the same. So I have bobblehead, I have a 24-hour feeling of choking and foreign body sensation and clicking in my throat. My head zigzags when I nod yes because I have injury to my atlanto-occipital joint. And I have difficulty walking, so I have leg weakness and my legs collapse, so I need someone to hold my arms when I walk, and I need to wear my brace. So for the first 2 weeks after PRP, they kind of stay around the same baseline. And then weeks 3 to 6, I deteriorate, I get new symptoms sometimes. So this second round of PRP, my legs again became extremely weak. I saw a different AO that was closer to me to try to get some more support closer to my parents' house so we wouldn't have to travel so far. And even with the best intentions, that AO wasn't able to line me up and made me so much worse. My head was locking for the first time, so if I moved my throat, so it spoke, if I ate, if I moved my tongue, I would feel like almost like my hyoid bone moving and my head would lock into a certain position. So we went to the hospital. I was seen by neurosurgery. Basically where I live, CCI doesn't have any treatment. So I was told to go to the USA for treatment. There was nothing they could do for me. But it was very, very scary for me and my family to have these new symptoms where my head was locking. You know, it's very real. But CCI patients also get a lot of medical pushback or gaslighting. And it is really important to find the doctors and the people who believe in you and that can safely help you. So after all of these symptoms, I went back to my original AO, who was just wonderful. I'm gonna tear up because just amazing at what they do. And sorry, I just took a little bit of a breather. So my atlas orthogonal is the only one that I will ever let adjust my neck again. And the AO is such a crucial part of my healing. I'm now about 9 weeks post PRP, my second round of PRP. And the benefits that I'm seeing are when I close my eyes, if I have my neck brace on, I don't fall over. So I have better balance, and the alignment is so important. So I notice the benefits of the PRP only when I'm in alignment. When I'm in alignment, since the PRP, I have better balance. I have more manageable tachycardia, so my POTS is better, so I don't feel faint when I'm standing upright in one spot waiting for someone for even 10 seconds. But I continue to have difficulty walking alone. It's almost like my neck needs proprioceptive feedback, so I need to be holding on to someone when I walk, and I need a neck brace. And I need to be in alignment for my swallowing to feel a bit better. So it's hard for me to explain. I still feel the benefits of the PRP, but I need to have my alignment in place. And I'm also still working with the AO because there's some things that are just not normal that we're trying to figure out. I still continue, even when I'm in alignment, I can't nod yes in a straight line. My head zigzags. I have difficulty swallowing, and there's like a clicking that pulls my hyoid, it seems, and my head will actually move. It's not as bad right now because I've been adjusted. And again, I have the collapsing weakness in my legs, which is worse if I go up even a slight incline. So there's lots that I have to figure out. Our next step is I'm continuing to do my meditations, my mindfulness practice, which is just helping me stay positive. I'm really proud of that. It's a really difficult journey, so that's really important for me. Being out in nature has really helped me. As the summer comes around, I just sit on the porch and I just watch the birds. And the other thing that's helping me is staying in alignment. So we are trying to see my AO more frequently to try and make sure that my C1 is in alignment. And then we're gonna try to figure out what to do with my swallowing issues and what that looks like. And then hopefully I can receive the PICL procedure, which is essentially something I'll talk about in a different video, but it's a method that's only done by 2 doctors at 1 clinic in the entire world, and it targets your alar ligaments and your transverse ligament through the roof of your mouth because you can't access those from the posterior neck. So that's something we're looking into. Timing wise, I'm not sure. And the other thing I wanted to let you all know was that I wanted to do a question and answer session on YouTube, just a Q&A video, because I receive a lot of questions about my condition and the treatments. So if you do have any questions, please leave them down below and I'll do a separate video just answering your questions. Okay, take care everyone. Bye.